Shall we start, sir?
I'm ready with my presentation.
Yes, sir. So it's 7, sir. Shall we begin, sir?
Okay, no problem. I'm ready with that.
Okay, sir. Learning is the beginning of wealth. Learning is the beginning of health. Learning is the beginning of spirituality. Having a heart to start learn is where the miracle process all begin. Good evening, everyone. With great joy and immense pleasure, I extend my warm welcome to all dignitaries, guests, and delegates present here for the Dr. Sudhir Raj N Memorial free webinar series organized by DIKSHA E-Learning in association with Ayurveda College, Coimbatore under the banner of Azadi Ka Amrit Mahotsav. In today's session, we will be discussing about Fundamentals Anatomy for Undergraduates by Dr. Pralhad D. Subbannavar, sir.
Before starting the session, I would like to go through few of the basic instructions to be followed throughout the session. For uninterrupted class session, use laptop with high-speed internet connection. Please make sure your microphone is on mute to have a disturbance-free session. In case of any disruption, please check your internet connection firstly, and if the problem is within our network connection, kindly raise the issue in the chat box. Filling your name to be displayed is appreciated. Any questions can be posted in the chat box. Questions raised will be clearly at the end of the session. Next, I would like to invite Dr. Karthika, Assistant Professor, Department of Dravya Guna, Ayurveda College, Coimbatore, to deliver the welcome address.
Good evening, one and all. I'm Dr. Karthika from the Department of Dravya Guna Vijnana, Ayurveda College, Coimbatore. On behalf of Ayurveda College, Coimbatore and DIKSHA E-Learning, it gives me immense pleasure to extend a very warm welcome to our guest speaker, Dr. Pralhad. As you all know, we have our elegant speaker here to deliver, to discuss about the topic, fundamentals of Sharira Rachana, and especially to the undergraduates. I extend a warm welcome to you, sir, and for accepting our invitation and for being with us here today. Once again, let me proudly welcome all the delegates who are present here. I hope this session will be a wonderful one. And thank you, sir, for being here. Thank you all.
Thank you, madam.
Thank you, ma'am. It's a great pleasure for me to introduce our guest speaker, Dr. Pralhad sir. He is currently working as a professor and head department of Sharira Rachana at Enopeya Ayurveda College and Hospital, Mangalore.
Sir has also organized several national and state level webinars and also published a list of articles in journals including International Journal of Scientific Research, International Ayurvedic Medical Journal, and Journal of Ayurvedic and Integrated Medical Sciences. Sir has also contributed greatly towards community services like museum development and preservation of wet and dry anatomical specimens. He has also been awarded with Dr. D. Virendra Hegde Pattabhisheka Award 2008 and an award for Best Paper Presentation, Kalan Vasion 2019. We are extremely privileged to have you here on this platform, sir. Now, without any further ado, we will turn the time over to respected Dr. Pralhad sir to enlighten our minds with his knowledge. Over to you, sir.
Thank you very much, madam. I think I'm audible to you all. Yep. So my sincere thanks to the management of Coimbatore, and a special thanks to Dr. Anjana. Especially she has invited me for this particular topic for the guest lecture. And again, I'm very much privileged to take this kind of topics for the undergraduates. So before starting the presentation, again, I will express my sincere thanks and gratitude towards all the members of the management and principal of Ayurveda College, Coimbatore, and all the faculty members and the IT people who have given this platform for us for the sharing the knowledge. Thank you, one and all. And then I just brief about my presentation. Today, it's morely focused on the undergraduates, where they just finished about their 12th standard, and they have more of ideas and more of information about the anatomy subject. If you consider with the other subjects, so they have a kind of the confidence, or they have some kind of the information about our science. But compared to the other subjects like Padartha, and they are more interested, and they are more concentrated about this subject. So going to the further slides. First, I have two sets here. First, I will start with about the basic anatomy, history, and importance, and other aspects. And in the second part, explain about the Sharira, about the views of Acharya Charaka and Acharya Charaka, Sushruta, and other our Samhitakaras, who have they have shown some kind of the importance of Sharira in either in treating or maybe in medical aspects, or maybe in the clinical aspects like that. So going to the slides. So it's constant motivation and guidance from my teacher. So Dr. Murali Sharma is a emeritus professor in College of Ayurveda and former medical superintendent of the STM Hospital, Udupi. So because of him, we have so fortunate to incur some of the information and learn some of the Samhitas and all. Thank you, sir. Now, coming back to this slide, foundations of the medical education, and taught since so you have seen that any history, any science, or any particular development which starts from early beginning, and they have invented, they have made some kind of basic inventions, and after some kind of updation in that particular inventions. So this is also started with the same thing, like this foundation of medical education. Some of the importance of this subject will be a basic foundation for the medical education. And second thing is the amount of information prepared to young doctors have evolved and changed in association with demands of the medical profession. So without a particular proper knowledge of the science or anatomy, so one cannot become a practitioner or a good clinician. So it has now taken up in a very fast manner, so that you have to develop some of the skills which is most required by the doctors. And third sentence is about the change that today's what we are having when we go to the dissection hall. We have a cadaver in front, and we have a lot of YouTube videos, and we have a lot of the information about the PowerPoint presentations, and we have got some live classes and all. But before that, if these things are not available at that time, so they have done so many works. For example, the public dissection. So if you go through the basic, the earlier history of anatomy, where we have seen that the dissection, even though we have all these modern teaching aids like your PowerPoint and all other some kind of the teaching aids, still dissection is a part where it's actually give us more information, and dissection is a part where we know so many things. So that's called as the earlier days it was made a public dissection, where the group of doctors, a group of anatomists will stand and then they used to learn from that. But now it is limited to the college wise. So next is the can be considered as the anatomical demonstration used in the practical classes. Right? So going back to some of the anatomists, or some of not actually anatomists, but they are doing some other the philosophical, or maybe some might be a poet, or some might be a writer, maybe a good drawing teacher. So they all gathered, and then they start to invent about the instrument. So Vesalius is a man who we used to remember him about this circulation and all, and the structure of the vessels and all. So what he suggests is the firm foundation of the whole art of the medicine, and it's essential preliminary. So without the knowledge of anatomy, nothing can be possible either in the science of medicine. So if you look from the William Harvey, so whatever is the books, whatever we read from the books is not going to help us unless we do the dissections, right? So when he is not from the tenets of philosophers, but from the fabric nature. So fabric nature in the sense, when we dissect, we'll come to know the different nature of the tissues, different texture of the tissues, where they are the real, the information, they are the real topics where we learn from the academy. And second, Robert Liston, he also given one beautiful saying that foundation of study of art of operation must be laid in dissection room. So without the particular help of some, if you're not having a dissection class, so then it's very difficult to imagine about the subjects, how we are going to understand about these things. So again, we have some kind of margagony. I think you may remember, or you come across certain the margagony in the second term, where they who dissected, inspected, lays to the doubt, while others who are ignorant of anatomy and do not take the trouble to attend are in. So when you read a textbook and then you compare with the particular steps in the cadaver, then you will have some kind of doubts, some kind of confusion, some kind of the kind of clarity will come. Unless you don't see the particular dissection, or if you don't do the dissection, don't involve the dissection, it's very difficult to imagine. Next is about another few informations about the fundamental subject, branch of medical sciences, study of body parts, relation to each of every individual structure through dissection. So imagine we teach so many things. I think many of you have heard during your 12th standard. Nowadays, everybody is going through this the E subjects, like maybe a kind of available apps where you can see so many things. But virtually, when you see that, but when you involve in the dissection, your knowledge or whatever you have learned, whatever you have seen, they'll become perfect. And second part is during the medicine. Forget about the understanding subject. During the medicine, so that kind of the information comes about when you see virtually, when you touch that particular structure virtually, then you can imagine the disease. You can imagine the disease, what sort of disease will come. And coming to the third point, where during surgeries. So imagine any simple surgeries or to be major surgeries. If you don't have a basic anatomical knowledge of structures and relations in between them, and how they are supplied by which group of arteries, which group of nerves, it's very difficult to imagine. So especially for the surgical specialists, they need these things. And also the if you go on classifying these things like neurological system, musculoskeletal system, cardiovascular system, so all these group of systems you require a basic knowledge of anatomy. Now I don't know about how many of you are aware of these things. So these are the information which you can get in the internet about the importance of anatomy. Like maybe you are all first year students where you are hardly have these kind of the statistical data and the published articles. So if you look at these things, so the study is conducted in 2019 where the clinicians relevance of learning anatomy to the clinical practice. So their topic is, so they have taken a particular statistics or the data from, they are prepared with 9 questions where, so they've asked about the clinicians about the importance, knowledge of anatomy for them. So if you look at that, almost a physical examination, if you want to see a patient, if you want to do the physical examination in a patient, 60% of the responses where anatomy is the part where it is required. And second part is about imaging and diagnostic. Now everybody have read with your X-rays, USGs, MRI. You might have heard these things. So they are called as the imaging or the radio diagnostic studies. There also 66% they opine that anatomy is the basic, where without the help of the anatomy, we are not able to identify, not able to diagnose the things which are coming in the radiological part. We'll go to the next. Is the other studies conducted on the perception on the relevance of anatomy in medical education. So now they have concentrated more on the clinicians. So clinicians who are practicing, who are sitting in a clinic, they are watching the patient, they are seeing the patient. So where for them, whether it is required, whether that particular anatomy knowledge is required. So there, see, most of the people, almost 86%, they have point that contact is important to acquiring sufficient clinical knowledge. So important is cadaver contact. So many of you maybe you have started, or maybe some of you are going to start in a few months later. So once you are in contact with that particular cadaver, definitely you will have a very good knowledge about the structures. Okay? So then next percentage will be almost, I'm able to understand structure of human body through anatomy education. Unless you do this kind of dissection, very difficult. Next is about, apart from this, you will have a clinical support, you will have understanding of the subject. Next is about diagnostic imaging. Previous slide we noted that seeing X-ray and diagnosing it, there it requires anatomy. An important aspect also here, helped me to link my knowledge of basic sciences with clinical sciences. This is the 8th point, is very relevant. It's very important. See, whatever you have read in the text, whatever you have referred, whatever you have seen in videos, whatever you have, read in some of the articles and more, but try to see that once you learn the anatomy basics properly, then it's a possibility of linking your knowledge. You're linking. You might have heard, you might have drawn in diagram of heart, you've seen the stomach, about the stomach, but the basic knowledge you have. But once you see negative, that particular knowledge will be enhanced. That particular knowledge will be properly understood when you study anatomy properly. And finally, some of them last, analytical and critical thinking. Analytical and critical thinking. So this is a very technical terms where everybody will have that kind of doubt, or they have their own mind, analytical mind and critical mind. So whatever the subject the teacher tells, then you think in your own way, how you analyze this and how you think differently. So these things are by studying anatomy. So this skill will develop. That's also important. We'll go to the next slide. Second is the one more data, because you require this kind of data. So it is assessing the application of anatomy knowledge in clinical practice. Another study is conducted in 2020. So what they have done is 70% of the practitioners, forget about the teachers, forget about the curricular part. If you're sitting, or if you're not attending any colleges, you are sitting in individual practices, they have 70% practitioners palpating the nerves. So you know where which nerve comes in which part of the body, then only it is easy to take the diagnosis, probable diagnosis in your mind. So that you require about the how to palpate the nerve. And next about the cadaveric teaching might improve the knowledge of clinical practice than digital. Important. See, you have a digital era now, all the information about freely available by digital part. But when it is not up to the mark, you have the distraction. So what that study conclude that knowledge of anatomy is utmost important in successful clinical, dental, Ayurveda, homeopathy, whatever. The person who is going to treat the patients, he require the basic knowledge of anatomy. We'll go to the next slide. See, again, it is from the prestigious journal where will come this Springer link, where also in previous data I have collected from the our own nation collections. And next we'll go to the other countries where it is published in 2016 in the Springer link. So they have done the relevance of anatomy. So what they have done is, so they have included not only doctors, but they have taken students, they've taken clinicians and educators like us. So anatomy educators. So they have grouped it, and the data is the subjects, the number of samples were more. In that study also, they suggested that anatomy teaching should be more closely integrated with the clinical teaching. So now what they have in Western countries, now they have concluded, maybe in 2016, bit old it is, but still they have thought that without a patient, without a particular clinical teaching, anatomy is not a completely understood. So when we teach, so when we have some kind of applications of our subject, you want to see in that particular clinical teaching. We are thankful for this particular new syllabus what they have made. So they have made it early clinical exposure as a non-lecture hours. So you might have chance to see, you might have chance to see the particular patients when you can think what is the abnormality in that particular patients and compare to a healthy being. So this is what, so you need to go through these kind of informations where our particular anatomy is so much of emphasized. Then comes about, this is also taken from the JAMA. This is an article published in old 1984. So important aspect here is this particular article tells us that what they have done, I mean to say that recent advances are digital or your technology, which is more enhanced. So what they have done in American medical education, so they have reduced the part of curriculum. They reduced the clinical hours, the dissection hours or the teaching hours of anatomy. Rather, they emphasized more on the molecular as well as cellular areas. I hope in your 11th and 12th standard, you might have heard about your genetics and molecular biology and all. So that has done a major trouble, that has done a problem to the particular science of medicine, where the harm, they tell it as a harm that has been done to American medical education and a clinical practice. Both are involved. 15 years. Gross anatomy has been de-emphasized in medical school. So they have de-emphasized it and reduced the lectures as well as the dissection time. And they are more towards the research and more towards the molecular and cellular areas. That may be the problem where the medical education or the clinicians are not getting proper knowledge of anatomy. Right. This is about the information. This is about the importance of anatomy, what you can look in the Western countries. And next is about continuous development of understanding the structure, body, and the function of the organs. So this is not related to only first years. So when you read these subjects, it's this information, the knowledge what you can get is not limit to your first year BMS only. That will continue further as you go toward different subjects. And because it has got a prestigious history and most prominent in the biological science and until 19th century and early 20th centuries. So this is again the history how it has come up. And among this kind of, if you look at the different countries where, which of the countries where Egypt and Greece and Latin America and some other things, how they have developed from different sources. Like some have identified the heart and its vessels, some have identified the liver, some have identified the spleen. So they have documented it. So basically all these research and all these the information which they have identified during their particular era. So they have documented, and gradually now at this point of time, we are very much, equipped with so many information about each particular part of the anatomy. Right. It's about some of the histories. If you look at this timeline, so lot of information available in the, if you can get how the history, as you are going through the history of any subject, any science, you're going through the history of either political science, or it may be a kind of the other science which they have developed from the very beginning. So same way, we'll have to come across a lot of these informations which are available in the internet. Right. Next, coming to somewhat a different kind of explanation, like now you are at a stage where you have a lot of subjects which are easily understood, like Rachana and Kriya. Some of them, they are very difficult to understand. Maybe many of you have got some kind of Samskrita background, but still you feel some kind of an attachment, or you are connected to these particular subjects. So you have some kind of difficulty in going through these steps. So what exactly it is? So if you want to focus, if you want to understand one particular topic and one particular subject, take it as either Kriya or Sharira Rachana, then we have to focus ourselves. We have to change our particular ideology to look the subject in a very different manner. So like just on the right side image, you can see that. So you can't predict that particular image. So, but when you put a binocular and you have to concentrate on the subject, then the path will be available. So you can see the path where you can go. The path in the sense you can understand the subject in a better manner. Now the point comes about this. You have Samskrita, Rachana Sharira, Kriya Sharira, and Ayurveda Itihasa, Ashtanga Sangra, Padartha Vigyan. All subjects are bombarded in the first year. I think many of you have faced this kind of problem. How to solve this? And which subject I have to read first? From where I have to start? Or which type of notes I have to make? So this particular kind of example, on the left image, you can see that the textbooks, one image is that's all, that way of just opposite. So you are not concentrating any subject. One half hour you will read the Samskrita, then you come back there and you will read this one. In whichever interesting subject you go on reading the same subject. That kind of confusion will come in the initial phase of any person who admits into the different kind of curriculum. So rather, if you look at on the right side, where the instruments which are arranged in a very proper manner. So like that, we have to focus on our own studies, where if you go on the right image, you can have a kind of proper basic information in reading our particular subjects. So don't think all the subject at a time and then try to confuse yourself. Rather than that, you make a particular areas, you make a particular time, and then if you fix that particular subject, if you fix that particular point, so that it can be understood properly. All right. So coming back to this particular point. Example, I'll basically start with this anatomy, because your subject is like that, depends on which subject. I think you have some information about embryology, you have some information about bones, you have some information about joints, but that is not how you should understand the subject. So you have to have your own classification of that. Example is the levels of organization. First, you have to think of the levels of organization, how the body will become. So I think I'll have further slide which will be explained. Second point is about gross anatomy. So what you look into the particular body. Then again, you can think of the branches of anatomy. Then levels, then gross anatomy, then the branches anatomy. In the gross anatomy, you'll have the microscopic study of the whole body. Then when you enter into the regional anatomy, so you're making it a simple division, like a regional anatomy. So you make one region and then you study about the parts, like head part, the limb part, upper limb, lower limb. You divide it and then you focus. And then comes about the systemic anatomy. So in the upper limb, If you want to study the bone, then you have to concentrate more on the bone. If you want to study the joints, you have to concentrate on the joints. So this is how the systemic approach should be required to understand very easily about the subjects. Next is about, most important is the surface anatomy. So while you enter into the dissection hall or initial classes of the dissection, you get a chance about 1 or 2 classes about explanation of the surface anatomy, and you have your syllabus point about the surface anatomy, where without dissection or without making any this thing, no, we have to identify the structure on the skin. Like for example, some of, I think you might have heard about these things, like the prominences, bony prominences, and abdominal organs, where they are located, regions of the abdomen. All these things are made. On that basis, we have to go through, and you have to just where they are. That comes about microscopic anatomy. So microscopic anatomy, I think everybody well versed with that, because you have been seeing so much of the information about your histology and cytology and different microscopic structure of kidney and other things. That also one part where you require how much.
Sir, sorry to interrupt.
Yes.
Your voice is breaking, sir.
Okay, maybe some of the this thing is there. Network issue is there.
Yes.
I think I'm back. Is it clear?
Sir,
Am I audible now?
yes, sir.
I'm audible now? Okay,
Yes, sir.
fine. Shall I continue?
Sorry, sir. Thank you.
Okay, right. Next comes about the embryological part. So either you can divide as a developmental anatomy or simple embryology. I think you have gone through the basic embryology in your 7th standard or 8th standard, where you come across certain words like spermiogenesis, oogenesis, and that part comes, and we have a separate topic in the next is about pathological, that we previously the statistics what we have seen pathological. So whatever you are studying a bone, pathology of that bone important. The pathology of organ is important. So like this, you make us individual headings and then you have to read it. Next comes about the important aspect is this. If you take it in any way, the same thing will enhance. So first is atoms, and then atoms, then you go on the physiology, it will change into the part. If you go to the cell biology, it will turn into its way. You go to the genetics, it will go in its way, and you go to the evolution in this way. So this is how any particular part, always it starts from the atoms. It starts from the atoms. Then it develops into the different structures. If you consider the physiology or anatomy or genetics, whatever it is. Like if you go through this particular levels of organization, you will come across. You can see the atom from the molecule, and then there is a cell. From the cell is a tissue to organ, organ to the system, and then come to the organism. This is kind of the organization, cellular organization. On this particular basis, you may divide it microscopically, or you can divide the subject into the microscopic. Okay. Then there are certain terminologies, or the language of anatomy is important. Like, so when we are becoming a specific, like till now, till 12th standard, you have a gross idea about the bones, you have a gross idea about the structures, you have got gross idea about little bit parts of the bone and joints. But once you start learning in first year, then you should be very particular about these terminologies. They're called as the superior, inferior. I think, don't worry. So in your regular classes, this particular information will be definitely given in initial stage of the classes, where you need to know that. So if you divide it in a systemic manner, once you divide it, then you should remember what are the bones you are coming across, and the location of that bones is important. And second thing is, individual part comes in that bone, where they are located, either superior, inferior, and the lateral or medial. This particular term you're supposed to use rather than the common term what we used to have before the curriculum. So once you enter into that, you need to focus on these particular studies, because they are very important when you are imagining your own body, when you are having palpation on your own parts of the body. Then you come across certain clarity once you read a basic way of understanding. Next, we'll go to the further slide where, right, now imagine here. So it's organization of the cavities. So one cavity is present in another cavity. So that is what a body cavity is. This is called as a body cavities. A body cavity is a space created in an organism which houses the organs. So you have an idea about the brain, and now you have all the idea about the meninges, and then you have idea about the skull. This is basic thing what you have noticed. But thing is, you need to go through a systematic way. For example, so one cavity is there, like cranial cavity. Usually is a cranial cavity where certain organ is located. And if you consider the different cavity, which will come across in the further slides, you show that. We'll just see that particular how these cavities are occupied and which type of organ is located inside and how it is related to the different cavity, how it is related to the different parts. For example, if you see the cranial cavity, which houses the brain. Now, I think two cavities you can make it. So another term, ventral cavity and the dorsal cavity. Like this, here you can make it a ventral cavity. Sits ventrally to the spine. So if you imagine this is the spine here, then some cavities are present in front of that or anterior to that. So they're called as the ventral cavities. So these are the ventral cavities. So the first subdivision is the diaphragm. So here you divide part into two. Its diaphragm is the thoracic cavity and this is the abdominal cavity. It's thoracic cavity and the abdominal cavity. And further you have the pelvic cavity. So if you consider the posterior margin as a vertebral column, so interior to that, you will have three cavities. So like that, you have some ideology in your mind so that you can proceed with the information. So for example, abdominopelvic cavity from the thoracic cavity. So now you same term will come. So abdominopelvic cavity here in the inferior part and the superior part you have the thoracic cavity. So if you look from the other, you will have cavity inside the cavity. So one thing is there is a cavity created anterior or in front of the vertebral column, and then the same cavity divided into other divisions like superiorly, middle one, and inferior like that. So look at the other diagram also. You will have ventral cavity as well as the lateral image also. Now we'll go to the next slide. You can see here again you will have majority of the organs they will lie in the abdominal cavity. So they are called as visceras. So they all together they're called as visceras. The organs like liver, stomach, spleen, pancreas, kidneys. So very gross I'm telling you. This is not exactly, but once you open the abdomen, once you see the dissection of the abdomen, then you'll come to know a proper relationship, a proper location of these particular organs, where they are situated, how they are situated, in which way they are related. So these things will come across as I discussed about the importance of dissection. Will come across these kind of cavities, but you need to prepare yourself when you go to dissection. When you entering into the dissection, now you should be prepared that you today are going to see these kind of structures, these kind of cavities in the. So if you prepare like that, it will be very easy for you. Next comes about the pelvic cavity. So then you divide it, no? Pelvic cavity and abdominal cavity. So what are the contents of the pelvic cavity? Pelvic cavity hold the reproductive organs, bladder, and intestine, which they pass to the anus. So this is how the proper location is required. So earlier you have some information about large intestine and small intestine, but when you speak from the point of anatomy, it should be very specific which intestine, where it lies, in which cavity it lies. That is important. And once more, you have very clear idea about the peritoneum. So you might have heard this covering of the abdominal organs. You have heard it, but it's not simply covers. It's most important structure, and it's a very important and very complex type of structure where definitely you require 3 to 4 classes to understand about the peritoneum. Now, this particular slides will give us an idea about how these particular cavities are made. Again, you will have the smaller cavity. Now you have seen earlier diagram cavity inside the cavity. So cranial cavity and the brain. Again, you will have some kind of smaller cavity like a nasal cavity, oral cavity, orbital cavities, or middle ear cavity. Again, you will have some kind of cavities are present in cavities. So this is how the developmental anatomy tells us about the individual location or the cavities, and once you see the cavities, again you are concentrating more on the structures there or organs. Then some of the terminologies like anterior or anti, endo, epi, extra, hypo, infra, inter. So these, if you go on reading the textbooks, these terms will come. So what I suggest you is, initially, if you have a proper knowledge about these words or prefixes, it's easy to understand. Antebrachial, endometrium, epidermis, exocrine gland, extracellular structure, hypothalamus, hypo, and infraspinatus muscle, and interneuron. So these how they come in your regular syllabus points. Okay. So these things are required to initially, when you are, I think you are in initial stage, in the first term of the MS, you spend more time to read out individual informations. Next, coming back to if you come across some bones like foramen, fossa, fovea, meatus. So these are the things where individual bones, they have their own predominance. They have their own important identification marks while you go across individual structures like this. So foramen, what exactly it means? So you need to differentiate between a fossa, fovea, and a foramen. So these three important, almost they resemble same. They look very same, but you have a specific differences in them about this. They are meant to smaller one, or the location of that fossa may be different, or the foramen which are present in some part of the bone, or maybe a different parts of a same bone. That's important. Next about is the meatus, notch, and sinuses. So these are the, I think these terms will come in different topics also. If you're studying a particular osteology or bones, these are important. When you're studying in a different abdominal region also, they come across. So you need to be equipped with these things particular. So it divides like depressed and raised one. Depressed, what you can see, depression in the part, raised is more is the raised part, where you can see the crest, epicondyle, linea, process, ramus. So once you start learning about individual bone, like example, scapula you're reading, where it comes about the rama or the spine of the scapula. When you're reading the mandible, then comes about ramus. So these important, better that once you start about that bone, if you prepared this information before that, it will be very good, be well and good. Now, after explaining about these features or importance or history of anatomy, then how to go ahead with that and how to start with this particular subject, about how much you require for this, because for your curriculum, new curriculum, they have made it very clear about that, how to divide the subject, how much you have to read, what class you have to get for that information, and how many marks will be asked in the examination. So very beautifully they have drafted. So if you go through that, it will be very perfect. Next we'll go to the Ayurvedic perspective. So this Sharira, so what we can have in our own science, so how we can get the same kind of information. Till now I have been explaining about the modern part or the contemporary medicine, about the anatomy, their research, their particular history, and in the part of modern part of your syllabus. But if you look at the Ayurvedic perspective about whether these kind of information was there, whether these kind of the clarity was there in our samhitas, whether this kind of the specific structures or specific information is there. If you go through that, we'll have some kind of information also. If you open the Charaka Sutra, the 9th chapter, they told about the Shastra. So what is Shastra? Shastram Jyoti Prakasha. So any text or any book what you read, it will enlighten you. It will give a kind of guidance for your understanding, for your knowledge. So after that only you become a proper bishop or a good clinician. So almost it sounds very similar. Shastra, the Shastra, whichever, only don't compile to the anatomy. Whatever you read, that will give you an idea where from that instinct you can take it up and then you become a perfect clinician. Next point about the Sushruta Shari, the 5th chapter. Acharya Sushruta very clearly mentioned about the Sharire Chaiva Shastre Drishtartha Syat Visharda. So you need to gather, you need to equip with all the information about the Sharira. Because they have divided it. Either it may be related to your the microscopic as well as the macroscopic. So if you have any doubts, then it's very difficult for you to treat a patient. And second thing is, so he has also opined that all the structures which are present in the body may not be possible for the naked eye. So he also emphasized about the concept of microscope. There you can imagine about the microscope, but you need to about the Jnana Chakshu. So they told about Jnana Chakshu in the sense you need to be more knowledgeous to understand that particular hidden point what they have explained. So it's not possible that looking at the gross you're going to understand it. You need a special knowledge, you need a special sense which you can gather that hidden information also. And next about the same chapter, he explained about if you want to become Shalya Chikitsa or Shalya Tantrajna, so you need to have Nissamshaya Jnana. So you need to gather full knowledge, detailed knowledge about the body. Once you want to become a surgeon, then you have to go through the dissection part. You have to undergo for the dissection regular classes, so that information what you get from the contact of the cadaver, that is very important to become a good surgeon. So Pratyakshato Ishtarchartam only is not only possible when you read a textbook or when you gather knowledge from the textbook. Unless you don't do the cadaveric dissection, you're not going to your Jnana Vivardhanam. You're not going to have a proper, you're not going to have a complete knowledge of the body. Just look at the similarities between what our Acharya has told and what the earlier slides have highlighted. Almost it is similar. Same thing they have explained about this. We'll go to the next, where also they have given some kind of information about what is Shastra, how we can get the knowledge. So they have told about some of the information about a person who is having more knowledge. So you have to learn the subject from him, right? But it is gain knowledge such a person who has a mastery, because it's not possible to convince by the others. So you have, because of that way, you have a kind of teachers who will always guide to you. So that's what information what we get in the our Samhita. You need a particular person who has having both the knowledges, clinical as well as a practical knowledge, which will give you a kind of proper information about the subject. And second thing is the knowledge which one must obtain from a guru. It must be practiced theoretically as well as practically by the pupil. So we teach and you do only theoretically, it's not sufficient. So then what you should do is you have to learn the subject, you have to practice by theory as well as the practical, so that you become or considered as a Vaidya. Otherwise, they told that about the Taskar. So they have highlighted the point like Taskar. So because they are very particular about this information, so they use the particular term Taskar. Next is Eka Shastra. I think only reading one particular science is not going to help you in any manner. So you need to accommodate, you need to gather some of the information which is stored in other sciences also. Exactly what now we are doing. So you are gathering this information from your earlier science, you are comparing with your biology subject, and then you are taking information from the biology, and then you are going through your other subjects and you're taking some information over there. Then you are coming to the one conclusion about the subject. If you open the Charak Vimanasthana, there you have some kind of Roga Bishak Jitiya Viman. So in that particular chapter, Charaka explained about the points which are how to study, the methodology of study. Only by reading. Now you can see, now you come across on the hybrid mode, where virtually a teacher is not present in front of you, but still you can get the knowledge like that. So that kind of methodology was there in the earlier science. If you open that Charakavimanastham, the whole chapter is about this particular information about what type of the study and how you have to study, and what is the role of Guru, the qualities of Guru, the qualities of Shishya. So they have explained about, more explained about these information in. It's very important, and it's very interesting to know that at that time also they have thought about including these kind of informations, which now we are all practicing, what we are existing, what we are now seeing in front of us. So they have been practiced in our seminar class. Like, see, this is how we use a particular term like DIKSHA, Shuchi. So these things they have particularly used about, by simply you are not able to gather the knowledge unless, I think many of you have noticed, especially in South, we follow some of the rituals before going to school, or maybe you might have heard about Annaprashana, you have heard about the education system, how we start Aksharabhyasa, and how you generally we do all about the morning prayer, and also these are all important for us to gain the knowledge. So they may not sound in a different way, but they are very important. These things will guide us for getting a more kind of concentration in a particular science what you are using. So that kind of information we can go through about this chapter, where at what time you have to get up, and what sort of clothes you have to wear, and where you have to sit, and where you not, or where you have to avoid the particular places where you should not go there, you should not study there. They also explained. And second thing, they explained about these kind of the leaves. Now you are getting a leave on Sundays. They also mentioned about after 15 days you are getting a particular kind of leave. So this total methodology of learning is well explained in this particular chapter of Charakavimanastham. Next is very good aspect they have highlighted about Adhyayana, Adhyapana, Tat Vidya Sambhashana. So they have told about Adhyayana, how oneself have to read it, and then Adhyapana, how we can have a kind of the group together and we discuss particular the kind of discussion what we have to make it. You may compare to today's existing classes, or maybe our dissection classes, or maybe some of the classes where these things will be discussed with others, either a group of people or a particular man which is, or a teacher who is guiding you. And next comes about Tat Vidya Sambhasha. So Tat Vidya Sambhasha is that is if you consider the thing is called as the Adhyayana, Adhyapana, Tat Vidya Sambhasha. So this Tat Vidya Sambhasha is like conducting a kind of symposiums, like what exactly you are undergoing. So it's kind of Tat Vidya Sambhasha, because I have some kind of information and you are also learning from that, and you have some doubts in you and you want to clear that particular doubt. Same way we conduct in other manners also. We conduct some of the seminars, some kind of workshops. These particular kind of activities will enhance our particular knowledge, and then we may able to become a good or a perfect clinician. Like in further chapters also they have told about the Shishya, qualities of, let's say, Shila, Shaurya, Shaucha, Vinaya, Shakti, Bala, Medha. So these are the qualities one should have, because their ultimatum is to prepare you or to make you a perfect clinician, right? So for that purpose, these are the qualities where you should always remember, and so many other information also you can able to get it. And you compare this both the Charaka explained about the Sharira Avayavastu Paramanu Vedena Aparisankaya Bhavanti. So Charaka himself is emphasized on Sharira Avayavas Paramanu Vedena. So note, okay, Ati Bahutvad Adi Saukshmyavi Ati Indriva. So there are some of the organs in the body, so they are gross, they are large, some of Ati Bahula, some of them Saukshmya, and some of them Atindriya, Ati Bahula, Ati Saukshma, Atindriya. So Atindriya means you cannot able to perceive the kind of the structure without your naked eyes. So here you need to Sitesham Sanyogo Bhage Paramanunam Karanam Vayuhu Karmasvavascha. So there we need to imagine about these things, which the molecular status of that particular structure will be explained by Acharya Charak. So same thing they emphasized on the modern, where trillions of cells, structure for the body, nutrients from the food, convert the nutrients to energy, and carry out specialized functions. Look at the same, the meaning. Now they are telling seeing under microscope, but Acharya Charaka opined so many before that. So he has made it very clear that you cannot understand, you cannot have a knowledge because you have some of the structures are Ati Sokshma and Ati Indriya. Ati Indriya means you can't see that. You need to have a Jnana Chakshu. So such kind of the informations are available. So next, in case of Charaka 7th chapter also, you can get some kind of information about the there you can see some of the structures, how they are made, how they have seen, number of them, and then about the relevance of that structure. This kind of information you can get it in the Charaka 7th chapter also. Right. Coming to my concluding slide. So many of us will getting this kind of the textbooks what we have nowadays are almost translated information what we get. I'm not blaming anybody or anything, so that we are lagging behind to get the proper knowledge, because many of us was not thorough about the Sanskrit. So where we need to gather, we have to depend on certain subjects where we need to gather some of the informations. And Moola Samhita Adhyayana, many of the colleges have started. So they have started with the Sharirasthana individually, or separate hour is allotted for that. It's a very good idea to have a clear-cut knowledge about that. And interpretation of this, when you go across some of the next term, there you come across the word Mamsa, Snayu, Dhamani, Sirad, and Rajju, Sivani. That kind of so many nomenclatures will come. So we don't have a proper, the information about that. But once you look into the other part of the Samhita, like in the Indriyasthana or Chikitsasthana or Nidanasthana, where you need to get this kind of information, and we are able to explain that particular Mamsa as compared to the Mamsa. And finally, what is happening nowadays is translating the terms into modern anatomical terms, like one particular structure, they compare it into the another structure. One particular part, they compare to the other one. So it may mislead us in some of the areas where it may not give you a kind of proper information. So rather than depending on comparing on the subjects, we're going through our own science, like in Nidanasthana, we get so many Sharira informations. In Chikitsasthana also, we need some kind of informations. In kind of other the advanced status or advanced chapters also, we are having so much of information about Sharira. So I think almost it is time up. So I'm going to conclude my webinar, the topic on the fundamentals of anatomy. I have tried to gather about this information about both the parts. So I hope this particular presentation may help you in some manner. Thank you all and all.
Thank you very much, sir, for taking your time to prepare for such an extraordinary enlightening session, which was incredibly informative. We will now go ahead to the question and answer session, sir. Shall we begin, sir?
Yes, go ahead.
Delegates, please post your questions in the chat box.
Any questions?
Delegates can also raise hands if they have any question. Delegates can also raise hands if they have any questions. One can also post their questions in the chat box.
No questions. Nitin Kumar.
Sir, hope the presentation was well clear. Sir, we don't have any questions. Shall we wind up?
Thank you, madam.
Okay, sir. Shall we wind up, sir?
Yeah, thank you. Thank you very much. Thank you.
Yes.
Thank you very much, sir. I request Dr. Anjana ma'am, Assistant Professor, Department of Sharira Rachna, Ayurveda College, Coimbatore, to deliver the vote of thanks.
Thank you. Good evening, one and all. On behalf of Ayurveda College, Coimbatore and Team DIKSHA, it's my privilege and great joy to extend a vote of thanks for today's session. Dr. Pralhad sir has been my guide and a constant supporter during my PG studies. It was a really pleasure to have you here, sir. I would like to express my sincere gratitude for sharing your valuable experience and explaining these fundamentals on Sharir Rachana, as it was very relevant as NCISM has formulated a new syllabus for our students. So thank you so much, sir, for accepting our request in such a short notice and sharing your experience. Thank you.
Thank you.
I
Thank
extend
you, Dr. Anjana.
I extend my sincere gratitude to whole Diksha team for providing us with the best virtual platform. Let me thank all our dignitaries and delegates who have responded so well to make this session a successful one. We look forward to welcome you again in our coming sessions. Thank you. Thank you, one and all.
Thank you, ma'am.
It is the province of knowledge to speak, and it is the privilege of wisdom to listen. Thank you all for patient listening and the valuable time spent. To know more about our updates, please do stay connected with our social media platforms. That's all for today's most interesting session, with a lot of new information for us to close our eyes with thought-provoking knowledge. Thank you all for joining us. Thank you.